I'll have this involved too. Hi, I'm Stephanie Nolting. I'm a physical therapist at PT Connections, and I want to share more information about the pelvic floor. So we had a previous video that talked about the basics, some of the anatomy, and I wanted to go into more detail about how breathing is important to the pelvic floor. So we have in the anatomy, which you may have seen before, but a little bit of a review, a side view of the body here on this portion of this handout. And those pelvic floor muscles go underneath the body like a hammock. And any muscle in the body needs to have strength, flexibility, some speed, and coordination. We need awareness of the areas. So these muscles of the pelvic floor that help with bowel and bladder control, sexual function, and work as a support system for all the intestines and organs, they're no different. So most people will recognize those muscles as needing strength because we need them to hold in the urine or hold up the intestines. And while all that is true, a lot of times dysfunction will arise because of too much tightness in those muscles. And tightness can be because there is pain in the area, because there's been trauma to them, whether it's a horse accident, fell on a fence, sexual trauma, anything that makes those muscles abnormally tight. And then there's also situations where people have an alignment issue, which very much overlaps with back pain. And so many people across America spend millions of dollars on back pain. Not that any one person spends millions of dollars, but people across the nation spend a lot of money trying to treat back pain. And very often that can overlap with bowel and bladder dysfunction. So if your bony alignment is off in your pelvis and your hips, then you can do as many Kegels and breathing exercises as you want, and it would never correct the issue. But if we are going to assume that either each individual would need to be seen so they can figure out, well, do I have an upslip or a change in my alignment, or how do I fix that? Because physical therapy helps with that as well. But more generically, how do I stretch those muscles and make sure they stay as flexible and healthy as they're supposed to be if I already know how to do Kegels and tighten them and strengthen them properly? So the strengthening aspect comes from slow, deep breathing because the diaphragm that is under our lungs sits as an upside down bowl. And when we breathe, especially the deeper we breathe, it flattens out and puts pressure on the abdominal cavity. So as the diaphragm pushes down and is pushing on the lower section of the abdomen, there's muscles that have to move and expand a little bit and allow that to happen. So when you're taking a deep breath in, you should be able to feel belly muscles move out. And I'll turn to the side for a moment. So when you take a deep breath in, the belly muscles should expand. And you should practice that several times a day if this is difficult for you. I also cue people to try to breathe for 5 seconds breathing in and 5 seconds breathing out if they need a specific target. Otherwise, a little bit of quickness to the breathing makes it more noticeable on what is happening. If we breathe too slowly, then it'll be harder to notice change. Once you can accomplish a breathing and getting the stomach to expand as you breathe in, then you know you're properly using your diaphragm, then you want to move on to other areas. However, a lot of people will start to suck in when they're breathing in. So if you find that you're doing backwards and breathing in, sucking in, then it'll take some retraining from the brain and muscles several times over before it feels natural to breathe in and let it expand out. So the next area you would want to focus on after you've mastered belly breathing is to notice if muscles in the back are breathing. And it's not right along the center of the spine, but off to the side a little bit. And if you pay attention to those muscles when you take a deep breath in, they should also expand. And they're never going to expand as much as belly muscles. There's just not enough room in the anatomy. So it's much more subtle, but you should be able to feel it with your hand or feel it internally. So that would need to be practiced as well. And for people that struggle feeling these things happen, lying down is a really good position to feel those in. Upright positions, our muscles just have to do something a little bit different with posture. So if you're struggling trying this while you're watching the video, lying down is much easier. Once you've gone through belly breathing and back breathing, and you've kind of done the check and went, yeah, I can feel both of those happening, then you want to pay attention to your pelvic floor muscles. So the pelvic floor muscles going from the pubic bone all the way underneath you to the tailbone behind you, those you should be able to feel expand when you breathe. And again, it's very subtle. You won't feel this like a belly breath and go, oh yeah, I feel a whole bunch of movement. More subtle than even the back muscles. So if you struggled with that, you might have to practice and master that first before you expect anything to be felt in the pelvic floor muscles. If it's hard to feel internally what the pelvic floors or muscles are doing, sometimes you can go, okay, wait, I mastered the Kegel thing. Let me try that. I'm going to clench and squeeze and lift. And okay, now I reminded myself that's the area I'm talking about. But I will never try to Kegel and breathe at the same time because those are two opposite reactions of the muscle. Kegels are shortening and tightening. Deep breathing is stretching. So if you've done that brief Kegel just to remind yourself of the area and then do a deep breath, that'll increase the body awareness so that the body can pay attention to the right areas. If you still struggle and you go, man, I do not know if I'm doing this right, well, in the same way that we checked the belly and checked the back, you can physically check the pelvic floor muscles by putting one hand on your tailbone and one hand on your pubic bone. Now, most people go, well, I can find my belly and back just fine. How on earth do I find my tailbone and my pubic bone? So tailbone, you're going to put the middle finger right along the crease of the back, right back here, and put firm pressure. If you were to sit on that area, you would need to be slightly sitting on your middle finger to actually get to your tailbone. So it's slightly under the body. So if that helps you find, oh, okay, that's about where my hand should be. And just firm pressure with the hand so you can tell what is happening in the area. With the pubic bone up front, you walk down the softness of the belly until you get to the firm bone. And once you're on the bone, then you try the deep breath to see if you feel any movement from the hands. And you should notice about a 1/4 inch of movement outward away from each other. Where in the previous video we did Kegels, and Kegels would move inward about a 1/4 inch. And if those muscles are doing their job well, you'll notice it easily. For people that are first practicing this, they might have to try it 50 or 100 times over before they go, oh, now I feel it really well. Lots of times they'll feel it not at all in the beginning. Some people will feel it just in the front or just in the back, and they'll have to continue to practice before they go, now I feel both, and it's a symmetrical movement in if I'm Kegeling or a symmetrical movement out if I'm deep breathing. The next step is to add a stretched position so that you're having a positional stretch and then adding the deep breathing on top of that to give even more flexibility to the pelvic floor muscles. So I'm going to show a child's pose position that is well known in yoga. If you get on hands and knees, this can be done on the floor rather than on a bed. But from hands and knees, you just sit back towards the heels, hands go forward, forehead down to the bed. And in that fully down position, you would take the deep breaths. And now we have the belly kind of squished against the thighs a bit, so it restricts how much belly movement you feel and lets you notice more the back muscles and the pelvic floor muscles, particularly at the tailbone. So when you're down in the child's pose position, you would try several deep breaths and just notice what you feel. Take the time when you do that. You will notice the longer you spend doing that, the more stretch you'll get. So you'll feel all of your body sinking further into the position and letting the body become more focused and more aware of the pelvic floor as you're doing trial after trial. Some people will start off going, I don't know that I feel it. And then after trial number 5, oh wait, now I'm starting to feel something. And for someone that doesn't have dysfunction, they could try it and right off the bat go, oh yeah, I can feel that, no problem. But for people that are already struggling, which is probably why you're watching this video, you may have to try it several times over before you feel it, so try not to be frustrated. As always, if there is more follow-up, more guidance that you need, you are always welcome to call us directly, come in and be seen, so you know, oh, you know what, I've done my Kegels, I've done my breathing, I'm still not getting a resolution of symptoms. It would be time to have that one-on-one look of, well, now what is my bony alignment doing? Because if my bony alignment is off, I can be doing all the best Kegels and breathing and it's not going to give me my results. And that definitely requires a one-on-one training. So our clinic number, if you need us, is 719-565-6678. Best of luck to you.